Hip and knee arthroplasty is one of the most successful operations in all of medicine. It's a very straightforward operation that allows us to return patients to function and allows people as they age or have injuries and their joints wear out to return to full and active lifestyle.
It's just an excellent experience. They prepare you, they nurture you in the hospital, they pay close attention to what you're doing.
We work hard to prepare patients for the entire perioperative period, which is the period from pre-surgery to this day of surgery and post-operative and even going into discharge from the hospital. So it encompasses the entire surgical period.
This is where we were before the surgery with this right hip. So we utilize a fast-track protocol for patients that includes first by setting appropriate expectations for the patients, coming in agreement with them how they want to have their arthroplasty handled. So we utilize a very aggressive collaborative effort with anesthesia to give them the best perioperative pain control, minimally invasive or less invasive surgery. So we've developed techniques as well as modified instruments to allow for a less invasive operation. Less tissue damage equals less pain, equals less bleeding, equals quicker ambulation, and those things. That's what our goal is for the less invasive surgery.
Once you and your surgeon decide that joint replacement surgery is the best option for you, you will attend required preoperative appointments, including education and medical appointments. These will be arranged by your surgical team. We're gonna go ahead and get started. Everyone's here for the knee replacement class. Patients attend the preoperative education class, and the goal of that is not only to go over surgical procedure risks and complications, but also create expectations for the entire surgical process. On the same day of the education class, patients will see a rush medical doctor. They'll have a history and physical that's all time sensitive to make sure that they're as healthy as they can possibly be going into surgery.
The patient has to express their desire to go with the fast-track protocol, and with that we can tailor the experience to allow them to experience a quicker recovery.
Upon completion of required preoperative appointments, you will return home until surgery. Your care team will be working on your discharge plan to meet your individual needs. You will receive a call from Rush prior to surgery with your surgical time and any instructions for day of surgery.
So I understand you're having your left knee replaced. Good.
Hip and knee replacements are traditionally very painful procedures. And what we do here at Rush is that we incorporate a multimodal approach to pain management. We give patients medications that work in different ways and in combination that provide an outcome, meaning pain relief, that is superior to any one drug alone. We're very sensitive to the fact that narcotics during the time of surgery can lead to problems down the road. We are able to avoid narcotics much of the time by employing regional anesthesia or blocks. We're able to use local anesthetics or numbing medications instead of narcotics. After surgery, we're able to use the lowest effective dose of narcotics, and compared to other medical centers, we find that our patients go home on much lower doses of narcotics afterwards. Lower doses means lower side effects, meaning less nausea, less constipation, less itching, less sleepiness or dizziness. All in all, what it leads to is a better outcome for patients. They leave the hospital sooner.
Within 3 or 4 days, I was off basically all the medication that I needed to be on, at least the heavier stuff for the pain.
Our collaborative team includes, of course, my nurses, the surgeons, anesthesiologists, the hospitalists and internists that clear the patient ahead of time, the nursing staff on the floor, the in-hospital therapists, followed by the at-home nursing, at-home therapy, and then, of course, follow up with my staff in the clinic as well.
Care coordination on our unit is very specific. We have our multidisciplinary rounds every day. That includes physical and occupational therapy, providers, pharmacy, and nursing. So we all meet every day to individualize your plan of care to ensure that you're safe to go home after surgery.
I was sitting on the side of the bed 2 hours afterwards. I was ready to get up and just walk out of there, and they're like, no, let's just follow the procedure and we'll do the right thing.
Your surgeon, in conjunction with you and your care team, will decide the best route for recovery that is tailored to you, which may include going home the same day of your surgery, staying overnight at the hospital, receiving in-home care upon discharge, or at an outside facility. You will have an initial follow-up visit within a couple weeks from surgery to ensure that all aspects of recovery are going smoothly. please call the office if you have any questions or concerns throughout the surgical process.
I would highly recommend people come to Rush for their hips, their knees, their orthopedic replacements, because the experience was wonderful. I walked tall. My daughter said right away, "Did you grow, Dad?" And I said, "Nope, I'm just standing up straight finally."
Walking on. Yeah, that's pretty good.
I'm ready to
Can't
run.
beat that.
I'm ready to run.